My name's Professor Caryn West and I'm the Deputy Head of Nursing and Midwifery for James Cook University on the Cairns campus. I'm also the Director of the World Health Organisation Collaborating Centre for Nursing and Midwifery Research and Education, and I'm also the Dean of Research for James Cook Singapore. First of all, I'd like to thank you for the opportunity to be able to apply for funding through the Far North Queensland Hospital Foundation. You certainly support the researchers of North Queensland and Health very well, and I've been the recipient of a couple, and I'm absolutely grateful for that continued support. This particular grant was very dear to my heart, I suppose. When I finished my PhD in 2012, I was successful with a National Health and Medical Research Council Early Career Research grant, and at the time what that project looked at was the alcohol management plans in 3 communities in Cape York, but in particular when the alcohol management plans were brought into place, one of the clear outcomes was that they would make life better for women and children in particular. And I had a look, and nobody else had gone back and actually managed to see if that was the case. So what we did, based on a study that was done by Gladman sort of 20 years earlier, was we went into 3 of the communities, and they were discrete communities. So in particular, one had gone into full prohibition, another had also gone into full prohibition in 2006, but the third one still had alcohol available through on-site, but it was very limited through a sports club type scenario. So we went in and we counted injuries, and I read every file from 2006, so every entry of every person that had passed through that community, and we counted injuries and we logged them and categorised them. And what that gave us was insight into what sort of things happen within communities. And often when we look at injuries, we will say, oh, people in rural and remote settings, they have more of X injury or Y injury. But in fact, that's not always the case. The injury profile of any town or city really is a reflection of the activities that go on, and possibly some of the poorer choices that may occur within any sort of city. So, that was really groundbreaking. We ended up with statistics for 6 years, so it was a 6 full-year cohort that managed to capture a period just before prohibition or the alcohol management plans, through that period, and to a point where there was some talk about alcohol being allowed back into some of the more stringent communities. We took that away and wrote up some amazingly thick reports, as researchers do, and then a synopsis of it. And we gave it back to the community, and we flew back and we spoke to the mayors and the CEOs of the communities and the hospitals, and of course Cape and Torres Healthcare and Apuna Pima and organisations like that. And we were very keen that everybody got to have this information so that they could streamline their care. And there's not one blueprint that says just because you're a community in Cape York that you're all the same. And the outcome was clearly there were very different injury profiles, which allows the health facilities to really tailor the care and the resources that they need for the people of that community. So when this opportunity came up, we kind of thought, well, the profiles are changing again regarding alcohol and alcohol use in communities. So let's see if we can go back and extend that. So this particular award will allow us to go back to the 3 communities that we went to and repeat that process from 2012 to 2019. So in the end, we will have 14 years of injury data for 3 communities in Cape York. And speaking with the directors of nursing and Cape and Torres health nurses, this is invaluable information for them, because it really means that they can embed some of these findings within their policies and processes. And of course also the mayors and the CEOs within the communities, and more importantly the people within the communities, because we made everything that we have published, we made open access, we made sure that anybody that wanted to access it would have full access to it and not have to pay. So, you know, that is also an incredibly important way when you're working with people in communities so that everybody has access. You know, for instance, one of the papers that we wrote specific academic publications that were published that addressed the notion of, was it safer for women and was it safer for children, and what had changed overall as far as the injury profile had gone with regard to limiting or ceasing alcohol. But we also found some really interesting statistics that we wrote a paper with animal control. So the northern part of Australia is very close to parts of Asia where rabies is still prevalent, and we don't have rabies in Australia. So we looked at dog bite profiles within some of the communities, and we posed, I suppose, the question of if, and these are all ifs, this isn't the case in Australia, but if rabies was likely to enter Australia, could it happen through some of these closer islands in the north, and if so, what is the likelihood of dog bites and human interactions? You know, and we did a lot of work with the Department of Animal Safety, and they were very interested in our paper, and when they found out about this they actually wrote to us and said, is there another dog bite paper coming out? So, you know, for it, little out of our area of expertise, that, but what it shows you is that there's a lot of people that we can work with once we have this sort of data, and it's, you know, it's anonymised data, we can't take it back to one particular person. But it also showed that when you know, alcohol purchase and that was restricted, there was certainly a large increase in illicit alcohol that made its way into the Cape, which we know is incredibly detrimental for the communities, but also then there was illicit drug use that increased, and it was the drug use profile changed within some of the communities in the Cape. And again, that's a very sad knock-on of, you know, when controls come in, there will always be some people that push the boundaries and see it as an opportunity rather than, you know, we know the devastation that any of the illicit drugs cause in any community. So we have to put in for full ethics for this, and then we go through governance, so that's really important for any I suppose any of the remote communities, but it's very stringent for Cape York. So, and the governance is around making sure that there's just not a whole bunch of researchers roaming around and humbugging the population within the community, because they really are over-researched in many areas. So what we do is we organise with the mayors and the CEO that we're allowed to have access, and you know, we have very strong relationships now with a number of the Cape communities, so we're certainly seen as friendly, and the fact that we don't ask anyone for money, we take our own, is a bonus. But then we go and we ensconce ourselves in the health centre, and we tuck ourselves away in a little corner so we don't get in anyone's way. And there's actually an international injury classification framework that we use, and our data entry database is specifically designed to follow that, so that we know that we are following international categorisations of injuries and injury profiles. And for validity and consistency, as a registered nurse, I'm the one that reads the charts, and that also is incredibly important for confidentiality and patient safety. So I read every chart, and any time an injury is there, we log the injury, the type of injury, if anything else was associated. But it's really important to remember when you're doing an audit like that, that you record what is written and not what is hearsay. So what may have been associated is irrelevant. What was recorded as that injury is what is relevant, and that way, like I said, we've got consistency, we've got reliability of the data set, and we've got validity that across the fact that I have done I've done the first lot, and I will actually be the person that does the second lot, and normally my research officer is the one that enters the data. So, and then we clean the data at the end of the day. And you know, I think I was asked today how many charts in total I read last year, and I think it was probably about 10,000. So you get very quick at it, and you're not really reading. You're kind of looking for an injury to jump out at you. You know, it's important. I know, and I only found this out today. There was a talk, there was a council meeting and a community meeting in one of the communities that we go to, and that was in the last study, and they actually used the findings from our first study and our report to support their argument around changes to the alcohol restrictions. So, you know, for me, it's about making sure that the research that I do and that our team does is cooperative, collaborative, inclusive, but that it's what communities or industry or businesses or healthcare settings actually want and need, rather than something that a researcher just may think is a good idea. So it's always warming to know that the work that you've done is being used for the purpose that it was intended. There's a lot of people, I literally got out of a meeting just before I came out here, and the directors of nursing that I worked with last time just wrote straight back and said, "We are so happy that you're coming back, and thanks so much for this." And and that's down to you guys. That's really working with the hospital foundation and knowing that you see good and worth in the work that we do for the people of the North and the people that utilise your services. So, like I said, for me and my team, thank you so much, because it has certainly meant the world of difference, and this will be unprecedented, this data set. There is not a data set that is really, it's almost like a census, because we know that we have captured everything that has been documented in the charts. So to have 17 years of very clear data will just be an amazing outcome, and as last time, I'm hoping that much good can come from it.